The Office of Pharmacy Affairs Information System, or OPAIS database, is one of the most key pieces of the entire program. This database houses all of the information for all covered entities within the program, defining each organization's 340B sites, their contract pharmacies, and also whether or not their program is participating within a Medicaid carve-in or carve-out status. The Office of Pharmacy Affairs uses this to understand how each covered entity is going to operate their program. In addition to the Office of Pharmacy Affairs' use of the 340B OPAIS database, it's also used by manufacturers so that they understand which covered entities are participating in the program, as well as the wholesalers to understand who they can and cannot sell 340B medications to. It's really important that as a covered entity, you keep your information on the OPAIS database accurate so that all of the other participants in the 340B program know that you're eligible to receive 340B discounts that you can then pass on to your patients. An area of common confusion that we see within covered entity registrations on the OPAIS database is how do they describe what they're doing with their Medicaid billing? So the question that's asked on the OPAIS database is, at this site, will the covered entity bill Medicaid fee-for-service for drugs purchased at 340B prices? And while that feels like a very simple question, it can actually be a little bit more complex at health centers. The reason for this is that health centers often bill under what is called a PPS, or a prospective payment system. This means that a lot of times when they're billing Medicaid, their claims are bundled, and so medications are not billed out separately. This leads health centers to believe that they may not be billing Medicaid for those drugs. So the way it's best to answer this question is, did I purchase medications at a 340B price? And if the answer is yes, then you answer the question, am I billing Medicaid fee-for-service? If you also answer yes there, then you are going to answer yes on OPAIS to say that yes, we are billing Medicaid for drugs that were purchased at 340B prices. Once you've listed that, OPAIS is going to prompt you to enter your Medicaid billing numbers based on the states where you're billing Medicaid fee-for-service. Really important that you understand which numbers you're billing under. If you don't have that information, it's really great to get with your billing department and learn more about your internal processes.
Commonly we see that leadership makes updates to electronic handbook but fail to update the OPAIS database. So with at least quarterly reviews of your OPAIS database, these are findings that you will be able to catch so that they're fixed in the case of a HRSA audit. One thing we've recently seen when providing HRSA audit support is HRSA auditors checking the OPAIS database for authorizing official and primary contact phone numbers to match. It is important that you make sure that if those numbers change on OPAIS, that you update those in a timely manner. It is important to note that as sites are being added and active on the electronic handbook, that you add those sites to OPAIS in a timely manner during the registration period of the 1st through the 15th of each quarter.
Once a year, you have to log in at OPAIS and recertify for 340B eligibility. Part of that process is reviewing the information that's listed for your entity. That includes the authorizing official, the primary contact, your clinic locations, contract pharmacy locations, and even some of your Medicaid billing requirement. It's important that you spend time to review that information. You may not make any edits at all, but if you fail to complete the recertification process in the allotted time frame, you actually can lose 340B eligibility. So it's a really important step that you should be sure to take care of.
Another often forgotten feature of OPAIS is the 340B ceiling price tool. This tool allows covered entities to log in and check what the actual current 340B price should be. At the beginning of each quarter, often our wholesalers' price files are not always updated to show the current price for a couple weeks. So covered entities can log into OPAIS, find out what the current price should be, and then work with the wholesaler to get the corrected price. Sometimes you can do that in as little as 1 or 2 days. An important decision point for every community health center with OPAIS is to decide who is going to be the primary contact and the authorizing official. The authorizing official is somebody that can legally bind the covered entity. So this is often your CEO or CFO. The primary contact, on the other hand, is the person that's going to be most likely to get into OPAIS and make the changes on a quarterly basis. Often this is a director of pharmacy or a 340B program manager. You may make the decision to have it as a director of pharmacy because that person will also have access to the 340B pricing tool. This will allow the director to check pricing if they have any questions.
One of the ways that we help covered entities is by conducting detailed reviews of their OPAIS database. We're looking through all of the different information that they have entered to make sure that it's accurate. So we're going to compare it to a lot of different sources. One source is the electronic handbook. And so we're going to be looking to make sure that all of the sites that they have registered and active within the scope of their grant are matching the information within the OPAIS database. The next piece that we're going to look at is making sure that their contract pharmacy arrangements that they have active are also matching what is listed on OPAIS. The final piece is really checking on all of their additional information. So are they billing correctly with how they've designated? Are there individuals who are identified on the database listed correctly? And for our clients who are on our monthly service, we check this on a quarterly basis and periodically throughout the year as they have any changes to their programs. For those who have an annual audit, we're going to look at this intensively in the annual audit process. The OPAIS database is an area of frequent HRSA audit findings, but it's also an area where the covered entity has great opportunity to control whether or not that's going to happen. So by frequently being in the database, reviewing your program information, and making sure that it's accurate, you set yourself up for your best possible success in the HRSA audit. If you're not sure how to do that, and you would like help with that process, please don't hesitate to reach out to us using our website, FQHC340B.com.